Good afternoon. My name is Dr. Jagdish Chinnappa. I am the consultant pediatrician at Manipal Hospital and at my clinic at Koramangala. Today we'll discuss a little bit about fever and how parents look at fever. Fever is one of the commonest conditions for which parents come to a doctor. And many a times this is because parents fear that this fever is a sign of a serious illness in the child. And therefore they need to rush to a medical facility immediately. However, it must be known by most parents that fever is only a symptom of an infection, and most of the infections that take place in children are minor viral infections. These minor viral infections also can produce very high fevers. So therefore, most parents should look at the general condition of the child, how the child is in between fever, is the child playful, is the child active. These are things that the parents should note and not panic at every time that the child gets fever. Another thing that happens when the parent examines the child with fever is that they start saying, oh, his head is burning. So they start thinking that maybe he is going in for a brain fever. This is not true at all. Most parts of the body will be almost at the same temperature, and just because there is more blood supply towards the head may feel a little warmer than the rest of the body. Another very big fallacious thing that parents do is to start calling anything and everything fever. Fever should be measured. You should start looking at the temperature. Most children are very comfortable by doing a measurement of temperature under the armpit. Some of the older children, especially after the school age, can be measured with an oral thermometer. But the best thing to do is to use it under the arm. There are other thermometers like the ear thermometer which can be used also. Please do not use the forehead thermometer for checking temperature at all. Another very important thing that parents should note is do not start giving antibiotics and injections when the child has got fever. So these are some of the small things that parents can look at when the child has got fever.